Microscopic examination of hairs plucked or clipped by the examiner, excluding hair collected by the patient, to determine telogen and anagen counts, or structural hair shaft abnormality. The physician examines by microscope hairs plucked or clipped from a patient's scalp to determine telogen and anagen counts. The physician also looks for structural hair shaft deformities. Results of the test determine if hair loss is result of short-term biological changes, malnutrition, medication, or hereditary. Whole-body integumentary photography, for monitoring of high-risk patients with dysplastic nevus syndrome or a history of dysplastic nevi, or patients with a personal or familial history of melanoma. Whole-body integumentary photography, also known as dermatoscopy, epiluminescence microscopy, and skin surface microscopy, is a non-invasive technique of collecting images of skin lesions for identifying features of malignant versus benign skin changes. Immersion oil is first applied to the skin to remove the natural reflection of light from the skin surface and to render the outermost skin layer transparent. A stereo microscope is used to visualize the epidermis and the dermal junction. Dermatoscopic images are also recorded, and may be reviewed with the aid of standard or digitized photographs. Digitized images allow computer-aided diagnosis as well as image enhancement for viewing a lesion's distinguishing features. Digitizing also allows the images to be stored and retrieved when following a lesion's progression over time. Photochemotherapy, TAR and ultraviolet B, Geckerman treatment, or petrolatum and ultraviolet B. The physician uses photosensitive chemicals and light rays to treat skin ailments. This code applies to TAR and ultraviolet B rays, Geckerman treatment, or petrolatum and ultraviolet B rays. Photochemotherapy, psoralens and ultraviolet A, PUVA. The physician uses photosensitive chemicals and light rays to treat skin ailments. This code applies to psoralens and ultraviolet A rays, PUVA. Photochemotherapy, Geckerman and/or PUVA, for severe photoresponsive dermatosis requiring at least 4 to 8 hours of care under direct supervision of the physician, includes application of medication and dressings. The physician uses photosensitive chemicals and light rays to treat skin ailments. This code applies to TAR and ultraviolet B rays, Geckerman treatment, and/or psoralens and ultraviolet A rays, PUVA, used for severe skin problems requiring between 4 to 8 hours of care under a physician's direct supervision. Laser treatment for inflammatory skin disease, psoriasis, total area less than 250 sqcm. 250 sqcm to 500 sqcm. Over 500 sqcm. The physician uses the fiber optic handpiece to irradiate the lesions by using a painting motion. The treatment is usually painless and does not require anesthesia. Reflectance confocal microscopy, RCM, for cellular and subcellular imaging of skin, image acquisition and interpretation and report, first lesion. Image acquisition only, first lesion. Interpretation and report only, first lesion. Image acquisition and interpretation and report, each additional lesion. Image acquisition only, each additional lesion. Interpretation and report only, each additional lesion. Reflectance confocal microscopy, RCM, is a unique non-invasive technique that permits examination of the skin. By use of a confocal microscope, near-infrared light from a diode laser is concentrated on a microscopic skin target. As light passes between cellular structures having different refraction indexes, it is naturally reflected, and this reflected light is taken and recomposed into a two-dimensional grayscale image by computer software. This technology can be used as a diagnostic tool to investigate benign and malignant tumors of melanocytes and keratinocytes, as well as to study responses to treatments for conditions such as psoriasis, allergic skin reactions, and discoid lupus erythematosus. Photodynamic therapy by external application of light to destroy premalignant lesions of the skin and adjacent mucosa with application and illumination/activation of photosensitive drug, S, per day. Provided by a physician or other qualified healthcare professional. Photodynamic therapy by endoscopic application of light to ablate abnormal tissue via activation of photosensitive drug, S, first 30 minutes. Each additional 15 minutes. Debridement of premalignant hyperkeratotic lesion, S, i.e., targeted curettage, abrasion, followed with photodynamic therapy by external application of light to destroy premalignant lesions of the skin and adjacent mucosa with application and illumination/activation of photosensitizing drug, S, provided by a physician or other qualified healthcare professional, per day. Actinotherapy, ultraviolet light. The physician uses ultraviolet light to treat skin ailments. Unlisted special dermatological service or procedure.